during the last few years. That what we've done with expanding community health centers has been a good thing. What we've done with the community-based outreach clinics for veterans is a good thing. Most recently, after a couple of vetoes by President Bush, with the new president, we quickly passed the Children's Health Insurance Program, SCHIP. That will mean some 4 million children in our country.
Are you rolling?
Will be insured.
Are you going to stay there?
Daughters of working
parents
who didn't have either the resources or the health insurance itself for their employers. So those are all positive steps, but this is an opportunity in a much bigger way. This is an opportunity to deal with the 1.3 million, to make sure we can insure the 1.3 million uninsured Ohioans and the 45 to 50 million uninsured Americans. We also know there's another 40 or 50 million Americans who are underinsured, and with layoffs and with employers cutting back on health insurance and health coverage for their own employees, we know that problem is getting worse and worse and worse. That's why it's so very, very important that we move forward. This is our opportunity. In 2009, it's an opportunity because the voters in 2008 and 2006, when I was elected and many other new members in the House and Senate in 2006, the election of President Obama in 2008, and another group of new House and Senate members, it's clear that voters in Ohio and voters across the country were saying, we want universal health care coverage. Several years ago, there was a study of the 13 richest industrial democracies in the world, and they rated these countries. They measured. The study measured several different healthcare indices: life expectancy, infant mortality, maternal mortality, immunization rates, all those kinds of things. In the United States, of the 13 countries, the United States ranked 12th in these healthcare indices. But in one place, in one category, the United States ranked near the top, and that category was life expectancy at 65. So if you get to be 65 years old in the United States, your chances of living a longer, healthier life are greater than almost any other country in the world. And that's because we have Medicare. And Medicare clearly it's got problems to be sure, but Medicare clearly has meant so much to so many Americans. It's been in existence over 40 years now. It's taken care now of really 2 generations of senior citizens. And it's mattered so much to our country. That's why, as we work this health insurance bill through the House and Senate, as Becky said, there are hundreds of billions of dollars available in the President's budget to make sure that we do this right. But as this works its way through the process, it's important that there be a public program option in this health plan. That means that there will be a menu. Likely, there will be a menu of many private insurance plans for the uninsured to sign up for. But we know that private insurance in many ways has always sort of been a step ahead of the sheriff. They've always found a way to keep people out. They've always found a way to disqualify people that have pre-existing conditions. They've used community rating to keep other people out of their health insurance plan, because the bottom line is always profits. And the most profitable people are the youngest and healthiest, not the sickest. And so insurance plans clearly have not served, as a group, served the public interest. That's why we have, big reason we have this problem today. That's why we need this public option, a Medicare look-alike that can compete with these private plans. And if we have a public option that can compete with these private plans, what we know will happen is that the private plans will be better, and competition will make the private, as we regulate these private plans so that they can't use community rating and can't use pre-existing condition, but we have this public option to keep them, as I said, to keep them honest. The importance of universal health coverage is clear. It's not just the right thing for people. It's not just a humanitarian reason to have health insurance for everybody in this country. It's also not just a moral imperative. It's also so important for competitors' reasons. Don't think for a moment that a lot of General Motors problems are not because of huge health care costs that they bear. That countries around, that competitors around the world those private companies around the world that compete with GM do not have the cost of insuring their workers. So it's international competitiveness is one of the biggest reasons. The moral imperative is so important, and for small business, people that want to provide insurance for their employees and simply can't afford to, this legislation we will pursue is even more important. So I thank all of you. I particularly thank Brian for putting all this together, and Becky for your work. And Victoria, thank you for your work, and Isaiah, thank you for being here. And I'll take questions, and why don't Victoria and Becky and Brian come out if they have questions too? Why don't we all stand together? Come on up. Anybody, any questions for you?
Yes.
I'd like to know what you're looking at to address Victoria's issue. I think this is a big concern. You talk about people that are uninsured, but I think many of us who are insured live in moral fear we're going to get sick and end up in the same position as Victoria was.
The plan we write will deal with the uninsured and the underinsured, and people that don't have good catastrophic care, people that don't have care that could end up in bankruptcy because their insurance is inadequate, should be covered by these plans. I mean, it's clear to us that this is, I mean, it's so obvious that so many people that have gone into bankruptcy, have had to declare bankruptcy in this country. A big part of the reason is health insurance, is health care costs, and that's a big part of what this plan addresses. The public plan option will make them better by competing with them. It's not ideal. It's going to be so much better than we have.
It's a step forward.
It's a major step. It's more than a step forward. It's a jump forward. Yes.
I wanted to ask a little bit about, you said the comment, when we write it. So when is this going to be written? Obama has signaled that he wants something done by June, December, or summer?
Briefly, there are two committees, the Finance Committee, the Health, Education, Labor Pension Committee. Finance Committee's Chairman Baucus, the Health, Education, Labor Pension Committee's Chairman Kennedy. Come on that committee. We will be writing them jointly. There will be three components coming out of our committee, if this isn't too much inside baseball. One is for access, one is for quality, and one is for prevention. All three of them are, I won't try to rate which is the most important. They're all three very important in this whole effort. I think the committees are working well together. I think there will be something coming out relatively soon. I know the president wants it done, finished this year, so it means we need to. And then as soon as we go back next week, the writing is beginning now. As soon as we go back next week, you will begin to see more public activity.
So when you say soon, do you think by June we'll have something written?
I don't know. Possibly by June. I don't know.
And how much have the committees looked at Massachusetts as an example?
We're looking at everything. We've had a series of hearings in both committees and subcommittees for weeks now. Massachusetts has some problems, but by and large, it seems to be working pretty well. I think we will learn lessons.
Time for a final question?
I have one more question, but I don't want to hog it. But my question is why is this different than Hillary years? Why do we think something's actually going to happen this time?
It's different in large part because the business community understands that we need to do something significant. The business community in this country stood on the sidelines or worse in 1993. They now know that this is worse. This is a crisis in this country. They understand that it's not just a humanitarian question for them. It's a bottom line question. Too many American companies are having too much difficulty competing internationally because of the healthcare costs they bear. Too many small businesses are just getting rocked with healthcare costs, and they know that they've got to deal with it too. And so we're seeing a lot of businesses come to the table when they stood on the sidelines before. Also, the insurance industry understands that they better change. They understand that they've been in the system for too long. They might not put it that way, but they understand that the country's not going to tolerate that their behavior and community rating and pre-existing conditioning keep people out for much longer.
One thing I would comment there is I think the key thing the senator said is that the people aren't going to tolerate. The business community and the insurance industry are paying more attention, but there's no question this country is paying attention and determined, unlike during the Hillary years, determined to make change. The with nearly 50 million people in crisis and the economic crisis on top of that, no health care, no jobs, and barely making it, there's a very low tolerance for a Congress that does nothing.